Tips on hoarseness from an expert. Hoarseness is an abnormality in your voice. It can be breathy, raspy, strained, weak, higher or lower in pitch, inconsistent with breaks, fatigued, but whatever type it is results in making it harder to be understood and speak. Causes of hoarseness. Acute laryngitis is the most common form of hoarseness. Sore throat and laryngitis are quite a common conditions and can be associated with colds, other viral infections, or from the strain of yelling, singing, or speaking in public. Patients should rest their voices when they have laryngitis to avoid serious damage. Growths on the vocal cords such as polyps, nodules, cysts, etc. that are non-cancerous. This can occur from excessively speaking/singing improperly, too loudly, too often, or may occur from trauma. Smoking can lead to hoarseness as well as increases your risk for cancer. Smoking as a cause of hoarseness requires that you should see an ENT, ear, nose, and throat specialist, or otolaryngologist, as soon as you can. If your hoarseness lasts 4 weeks or more and you smoke, you are at a higher risk of developing throat cancer. See your ENT doctor for your hoarseness, which does not resolve with voice rest and lasts more than a few weeks, or if you have severe changes in your voice after a few days. Certain neurological disorders such as vocal cord paralysis or weakness, Parkinson's disease, etc. can also be a cause. Certain viruses, complications from thyroid surgery, spine surgery, trauma to the neck, etc. can cause weakness to the nerves, causing a weak, hoarse voice. Cancer growths on the vocal cords can cause hoarseness as well. If this lasts 4 weeks or more and you smoke or have other risk factors such as HPV history, you should be evaluated by an ear, nose and throat specialist. Gastroesophageal reflux disease (GERD) can lead to hoarseness. Gastroesophageal reflux disease, or commonly known as GERD, which is the regurgitation of acid from the stomach into the throat, can cause hoarseness. Age-related atrophy of the vocal cords is another probable cause. Some patients have yelled so loud they can hemorrhage by breaking a blood vessel, which can lead to hoarseness. Yelling is a very common cause of laryngitis, one of the common causes of hoarseness. If you have difficult breathing, pain when speaking, see an ENT doctor. If you're a singer, teacher, public speaker who cannot do your job, see an ENT doctor. With all these probable causes, it is best you rest your voice and see an ear, nose and throat specialist when you notice an unusual change in your voice to rule out serious underlying conditions. Allergies, trauma to the larynx, thyroid problems can lead to hoarseness. Avoid speaking too loud. Try to be aware of how loudly you are speaking. Use a microphone or other type of voice amplification if your job requires a lot of speaking. Drink plenty of water, avoid caffeinated coffee, tea, and soda. Stop smoking and avoid secondhand smoke. Please see an ENT specialist to be evaluated for persistent hoarseness.